podcast. My name's Kaylee and I'm with Alicia today. I'm a fourth year student at UWA. Hopefully I will be working at Sir Charles Gardner Hospital next year. My undergrad before I started med was in biomedical science with an honours in medical research.
And I'm Alicia, as Kaylee introduced. So I'm a second year medical student at the University of Queensland. I did my undergraduate degree in science at UQ, majoring in biomedical science. And then I applied for medicine in 2020. So I sat, my experience with med school interviews was back in 2020 when I applied sitting interviews for UQ and Flinders.
Yeah. So we're going to start just by doing an overview of how the interview works for those who haven't done it before. So generally the most common structure is what we call the multiple mini interview, or the MMI for short, where you've got about 8 to 10 different stations that you rotate between with a different theme for each station. But some universities do traditional panel interviews as well. Alicia may be able to speak a bit more to this, but some of the structures have changed a little bit because of COVID, with many interviews now being online.
Yeah, so when I sat my interviews in 2020, they were both online, which I think has benefits and disadvantages, but honestly, I think it was a rather smooth experience, and most of the people that I've spoken to seem to agree. Yeah, it's a little bit less nerve-wracking when you're in a space that you're familiar with, I think.
Yeah. And there's different types of online interviews as well. Some you do have the sort of traditional speaking live with an examiner, and there's a few others. A few of the med schools require you to record your responses rather than actually talking to someone live.
Yeah, I think
So,
as well,
what
with
top?
the recorded responses, they're often in real time. So they'll give you 2 minutes
Mhm.
to record it in real time and submit it straight away. So they don't really allow for a lot of pre-preparation, just to clarify, because I think that can
Yeah,
sometimes be kind of confusing with ones when they ask you to record.
yeah, yeah. Thanks for putting that in. That's pretty important to know. So we'll talk about the MMIs first, because they're the most common, and many of the online trials are kind of based off the MMI. So with the MMI, you have 8 to 10 stations depending on university, and each station has about 1 to 3 minutes of reading time with 5 to 10 minutes of talking time. And as I mentioned before, generally each station has a theme, so you might have one station that's about ethical situations, another station that's about explaining scientific terms. You might have another station where you have to discuss a photo or another stimulus, and it goes on. And generally you have 3 to 5 questions based around that station's theme, but it can vary depending on the university.
Yeah, and I think as well, the different stations, as you said, they kind of have different themes, but they're also not always question based. And so sometimes you can you might have to work together with another student to solve a task, or there may be role playing, or data interpretation. There are lots of different ways that they can examine you in those minutes that they've got set aside, other than just questions. So depending on what university that you're interviewing for, you may get different sorts of scenarios or tasks handed to you.
Yeah, it's really important to try and find out as much as you can about your university's interview style because of all those differences. Generally, the main differences are the number and the length of stations, as well as the types of stations. There's a lot of overlap between the universities, but sometimes there might be different topics covered between them. So make sure you really read your interview offer letter carefully, as that will be your main source of information, especially now a lot of us have to sign non-disclosure agreements.
Just reading, yeah, making sure that you try and find out as much information about your interview specifically. Just because, as you mentioned, they each have different styles, and you don't really want to be it's a nerve-wracking experience as I think already, and I think that it's always best to know what to expect so that way
Hmm.
you can kind of be prepared to handle it.
Yeah, like you
Um,
don't really want to be caught short.
yeah, and I mean, if you are, as I think one of the advantages of like, don't let that scare you. Like, if you are caught short, another one advantage of the MMI style interviews is that you move on to the next station and that you've got a new examiner and, you can kind of start fresh. So you're not like, you can mess up one station. It's not like
Mm.
overlapping onto multiple stations after that. You can kind of still do pretty well overall in the interview. In fact, I have quite a number of people who have told me that when they sat there, um, multiple mini interviews for whichever university, that there was one or two stations where they just really felt like they didn't do as well as they could have, but then they end up doing well overall because it doesn't like it completely is so separate to the next station that you have.
Yeah. Like each station is marked by a different examiner who has absolutely zero clue how you did on the last station. Which is a bit of a contrast to the other type of main type of interview, which is the traditional panel. It often covers similar topics to the MMIs, but you're sitting with the same panel for the entire time. So the biggest disadvantage of that is, well, if you mess up, you're stuck with the same examiners for the remaining length of time. Um, the
Mm.
upside of the traditional panel interview is that there's a narrow range of style, so it's possibly a little bit easier to prepare because the way that the interview is done, there's not really capacity for role playing or tasks involving multiple students, so you won't have to prepare for those if the university you're applying for is using a traditional panel. I don't know, Alicia, do you have any experience with
Yeah.
traditional panels?
So the Flinders University interview that I sat was traditional panel style. And I honestly found I felt like it was quite similar in terms of the kinds of questions and topics covered um, to my multiple mini interview. It's just a different layout. So I don't even know, like, as you said, I guess there's a more narrow range of things that they can ask you to do, but and I can't speak for like perhaps maybe other panel interviews may cover slightly different topics, but definitely in my experience, it was very similar content wise. The only thing was is you're looking at the same people the entire time, which is sort of different. Comforting in a way though, because you almost feel like you're having more of a conversation and you can get more you can kind of settle into it a little bit more. But as you said before, the disadvantage there is that if you like mess up or mumble or something, it might be sticking in your head a little bit more because you still have the same examiner. But then, you, pros and cons, you feel more comfortable when you're talking with someone for more than 10 minutes. Yeah,
So,
so there are like quite a few different themes. Um, and it can be a little bit different between university. I think we've kind of emphasized though that there's a
mhm.
lot of overlap, but I think we kind of have kind of mentioned a few of the different types of stations that you can get. And these kinds of topics are often like integrated into the stations no matter what sort of task you're given. Um, so a couple ones that we have listed here are like ethical scenarios or like behavioral situational type scenarios. You may be able to have to ask, we may be asked to explain some scientific concept in like simple layman's terms. You might want be expected to discuss your motivation for studying medicine. There are also a lot of in these ethical and behavioral scenarios, there are often themes of like public health, um, including like healthcare for specific populations such as like rural, indigenous, or elderly or underage patients, or like global health topics, that sort of thing as well. That can be kind of, and they can all be kind of integrated into one kind of scenario that they have like questions for as well. So it's not like one station's only going to be looking at one topic. Sometimes a few of those different themes that I've just listed off can be like kind of combined.
Yeah. Um, so starting with ethical scenarios, so I think this is the type of station a lot of people tend to get the most worried about, because of all the tricky thinking that you have to do. So a few examples of what you might get for an ethical scenario. First, you could get like a resource allocation question. So, for example, you have one organ and two potential recipients. So who are you going to give it to? And you'll be given some details about the recipients. Or you might get a topical ethical dilemma. So at the moment, the big topics would probably be abortion because of Roe v. Wade over in the States, and voluntary assisted dying, given it's relatively recently become legal here, or in Western Australia, I mean. So you won't. A lot of people get concerned about these if they have a more controversial stance, but you won't be assessed on your stance. You'd be assessed more on how you navigate the ethical situations, because the examiners will understand that you could be on either side of the fence. I mean, this is why these dilemmas are controversial in the first place. The other type of ethical scenario you might get. Sorry? Yeah.
Oh, no, I was just going to add to, in terms of like how it's more about how you navigate
Yeah.
an ethical scenario versus like the stance that you take. And I think that remembering that as well when you're discussing it and explaining your stance, because you don't want to come off as too judgmental, harsh, or critical of people that reach a different conclusion throughout your justification. And I think that that's probably more of like a red flag in an examiner's eyes if you're, super firm and unyielding in your response versus if you explore the concept and then reach a conclusion. It doesn't really matter what the conclusion is, whether like what your opinion on that matter is, as long as you're clearly being more like explorative when you're discussing the topical stance, because I think they want you to acknowledge that these are really complex issues and you're not supposed to have a solution within 5 or 10 minutes that you're given, because a lot of these situations or scenarios or ethical dilemmas have been debated for decades.
Yeah. These are things that people with PhDs in philosophy debate about. So,
Yeah.
well, the other type of ethical scenario would be the more everyday kind of thing. So, for example, you might have a friend who missed an exam due to illness, and they want you to tell them what the questions were so that they can prepare for the deferred exam. And you have to talk about how you would respond to a situation like that. Occasionally, when you are answering these kind of situations, if you've experienced something similar before, you might be able to inject a little bit of that into your response, just to flesh out your response and give a bit more context to your answer. Is there anything else that you wanted to add here, Alicia?
No, I think that about covers it. I think, yeah, if you have personal anecdotes to add, it definitely is helpful. I think you underestimate how long 5 or 10 minutes is until you're kind of sitting there. So I'm sure that you'll find when you practice that it's a long time, and if you have a personal experience, it's definitely not a bad idea just to talk about it, as long as it's relevant. You don't want to be going on about something that's not relevant.
So the next type of interview question will be the sort of so-called behavioural questions. So these are more your sort of typical interview questions. So tell me about a time when you experienced blah. Like, I don't know, tell me about a time when you experienced betrayal or something like that. And how did you deal with it? So obviously these types of questions you will probably have a bit more scope to bring up your own experiences. So it's worth sort of thinking about this beforehand and collating a bank of stories that can be discussed. If you've had a few, really poignant experiences in your life, you might just really think about those handful of experiences and think about how you could use those to discuss different types of situations. That might be easier to do than to try and think of like a little trivial experience for every single emotion you can think about. Another type of behavioural question would be, how would you respond in XYZ situation? So it's kind of similar to ethical scenarios in a way. So, yeah, given a scenario and asked what you would do. And again, if you've had something similar or experienced something similar, you can bring that up if it's relevant.
Yeah, and I often find these sorts of behavioral questions are sometimes tacked on to like ethical scenarios. Like they may give you a scenario and they want you to discuss that scenario. But then, like, it's a real behavioral type questions are really good follow-up questions. I think, like,
Mm.
if the situation's about struggling with medicine, they may then go, well, how do you cope with stress? Or if it's about, dealing with relationship conflict, it may be, well, how do you cope with that? And what role do you often take? Or what skills or virtues do you think are super important in this situation where you're arguing with, someone that you're close with? And I think those sorts of personal behavioral questions can often be very easy follow-up questions. And they're often ones that are really easy to think of beforehand because you're just thinking about yourself. So they're really easy to prepare for, I think, as well. Whereas the ethical type situations are kind of a little bit harder to prepare for because you just don't know what they could ask.
Yeah, absolutely. Now, the next type of station is probably a little bit more straightforward in a way, explaining a basic scientific concept. So, kind of straightforward, self-explanatory, but the biggest thing here is that you need to use layman's terms. And if you're using analogies, you have to use stuff that the general population is going to understand. And that's a big thing, especially if you're doing a science degree and you're surrounded by people who are doing science degrees. Because if you're in that environment, you kind of forget what the general population knows versus doesn't know. So it's not a bad idea to try and find family members or friends outside of your degree who don't have a strong science background and practice explaining things to them. Because, words that you thought were pretty basic because you've known them ever since the first year of your undergrad, or high school even, might not be very familiar to other people who may have left high school at year 10 to pursue something else. So, yeah, that would be my biggest
Yeah,
advice.
I agree. Like practicing with people that don't study medicine or aren't from a science background is really, really helpful here. Um, and also like not forgetting that as I think you mentioned analogies actually, Kaylee, but as
Yeah.
well as analogies, like often these interviews will have a video component. You can use gestures, you can kind of visually try and, accentuate what you're saying as well. So don't shy away from stuff like that as well, because it's about communicating, and communicating
Mm.
isn't just, verbal language. It can also be visual, and analogies can help with that because you can use visual type analogies as well. And so can like hand gestures and that sort of thing. If it's something that if you're normally a gesture, like if you're normally like a talk with your hands kind of person, I would say don't feel like, you can't fidget, you can't use your hands. Like you can use your hands, and it does have a video component. And those sorts of things can be really helpful when you're trying to communicate and explain to someone like a concept that you may struggle with just simply words as well.
Oh, do you know if there's if these video interviews tend to have scope for like if you can draw on a pen and paper that you have handy and hold it up to the camera? Like, are you allowed to have paper and pen and all that?
Um, I don't think I was. I think it would just depend on the specific university rules.
Yeah.
Like, I think, and I don't remember which way around it was. I think one of my interviews I was allowed a pen and paper, and then another one I wasn't. So I
Mm.
think that like this is where it comes, where I guess like reading your interview offer letter really carefully. I think for my UQ interview, we even had like a pre-interview session where we could ask questions about the process. And obviously, they can't tell you like topics or anything,
Yeah.
but they do just tell you like what you're allowed to bring, that sort of thing. And I think that can probably like help you, and then you can gear your practice towards whatever resources you'll be given.
Hmm. The next type of station we're going to talk about is the old classic motivation for studying medicine. Why do you want to do medicine? So these are easy and hard at the same time. So easy because hopefully you know why you want to study medicine, and it's also something that you can anticipate being asked, so you can prepare for it. But it's also hard because everyone applying for medicine is going to have some sort of motivation for doing so, and they're all going to have probably similar stories to you. So you need to really make sure that you sound authentic and that you really genuinely sound like passionate about the reason why you want to do medicine. Um, and think about your own personal stories and how you can make yourself stand out compared to everyone else who is doing medicine because they want to help people, etc., etc. Any other?
Yeah, and I think as well, yeah, I think being specific to medicine is really key here as well. Like, I think that often we have vague reasons for wanting to study medicine, or not necessarily having them, but like that's often how people articulate them. And I think that a lot of reasons that people give are often not super specific to medicine alone. Like, there are a lot of different careers that could, um, have that element or fulfill that, desire or whatever it is about you that makes you want to study medicine in that way. And I think that this is where sometimes having like, you don't have to have one sole motivation, one story, one moment in your life that changed everything. Like, it can be, oh, hey, here's a couple different reasons that all led me to the final conclusion of medicine. And that's okay too. And that actually can be more specific then to medicine, instead of like, oh, I like to problem solve. Well, here are 10 or 15 different degrees where you're going to, or, careers that you're going to go down that you can problem solve in. It's not just medicine. And I think that having like maybe a couple different reasons as well that you are aware of can help it be a little bit more specific, and seems like it makes it sound like you've given it a little bit more thought as well.
Yeah. The final station we're going to talk about is the public health or global health type of station. So these are also stations that you can prepare for. So you need to think about the common hot button topics. So at the moment it would be vaccination, COVID, and hospital overcrowding. But then you also need to think about ongoing topics as well, such as refugee health and Aboriginal health. Um, and there's lots of resources online that you can use to read up about all the various public health and global health topics out there. Um, did you have any suggestions, Alicia, on where people can go?
Yeah, I often find just like starting with any random topic that you feel like you don't know a lot about, and then like I think listening to podcasts. I personally listen to them a lot as well when I just want, because they can be, depending on how much time you have, you can listen to ones of very different lengths about kind of a lot of different topics. And another thing that I feel like a lot when preparing for some of these like public health and global health type topics was just to ask people. Different people would have studied different things in university, and I remember having like a really long discussion with a friend of mine who had done a lot more public health subjects in her undergrad degree. And I learned honestly so much from her that I then actually went on to go and use in my interviews, just about topics about like health and public health and some of the challenges and disadvantages and that sort of thing. that I wouldn't have known otherwise. And I think that information can be really hard to access um, on your own. So I think that, finding someone that knows in your personal life is always nice because then you can have a nice discussion with them. But then podcasts are sort of almost like a discussion that you're just listening to from the sideline. So if you don't know anyone, I think they're a really good place to start as well.
Yeah, yeah, definitely. I think
Were there any
uh,
like resources that you
um sometimes just online newspapers, like the Guardian or Wall Street Journal or whatever seems to come up a lot when I'm searching up these topics. Um, Good old Google.
mm,
um,
yeah, and I
there's
think like
also
a few people might have even done some of this sort of like news, looking through the
yeah,
news, that sort of thing
hmm
in your GAMSAT study even. I know that I kind
yeah,
of did a little bit when I was studying for GAMSAT as well. So I think like maybe if you needed like a little signal not to stop that after GAMSAT and keep going for the interview prep as well, like I just think it's a really good habit to keep up with even after GAMSAT's over, and then it really helps with the interviews, I find.
mm. I also find it helpful that some of the outlets have like summary videos and things on YouTube, so that's a great like 5 minute way to get an overview of the topic before you start trying to really learn more about it.
Yeah,
Yeah.
definitely. They're very
So
helpful.
YouTube does have its benefits sometimes. um,
Yeah, or even I think I remember one of the news um emails, like subscriptions that I signed up for, started a like 5 minute, and I can't remember what it's called at the minute, but I think it might have been by like an offshoot of The Guardian or something. And they
mm,
did like a 5 minute daily recap that was like kind of like a podcast, but it's like 5 minutes, and it would just play automatically on my Spotify whenever I started listening to music for the day. And I think that can kind of help keep you up to date with like different things. And then if you hear a public health type thing in the news, then you can be like, oh, I'm going to read about that today. And it can kind of
mm,
keep you like abreast some of the new developments globally um, in that sphere.
mm. Yeah, it's a good idea to have a daily sort of reminder, I guess.
Yeah.
Um, so, last but not least, we're going to talk about topics to avoid during the interview. So, we'll talk about sort of general things to avoid as well as specific tips for the specific station types. So, general tips. So, while there's scope for putting in your own experiences, you don't have to discuss like every intimate detail of your life. So, if there's things that are quite distressing or uncomfortable, maybe don't talk about those. Um, Unless you think you can. Uh, if they're only like mildly distressing and you can talk about them, then sure. But if they're very distressing and uncomfortable, remember you're still going to have to deal with the whole rest of the interview. So pace yourself is my um, best advice there. Um,
Yeah, and I think as well, like practicing talking, if you have any experiences that you think are really like worthwhile or meaningful, that you think have the potential to be relevant in an interview type setting, practicing talking about them beforehand can help you figure out how you're going to talk to about it, can kind of desensitize you so that way you don't get super distressed or uncomfortable if it does come up in the interview. And it also helps you kind of figure out what your boundaries are in terms of discussing it and kind of finding a, because it is still a professional context, like a professional way and a relevant way to talk about those personal stories. Um, in your interview, which I think can kind of be hard without practice.
yeah. The other type of general topic to, I wouldn't say completely avoid, but we sort of talked about this earlier that if you've got very strong opinions that are a bit unusual and or controversial, it's not completely taboo to talk about them, but you need to talk about them in a way that shows the assessor that that you're not so strong-minded about it that you're unwilling to see other people's points of view. When you're talking about these topics, you need to make sure that you can show that you understand both sides, and that you're not, completely stuck on your way of thinking, if that makes sense.
Yeah, and I think it kind of ties in quite nicely to one of those sorts of things, one of the like central parts of patient interactions and what they teach you in medicine as well is remembering that, you know, you may treat people that have very different opinions to your own personal opinion. And I think one of the reasons why they want you to show that you can understand the other point of view in a controversy is that I think it shows that you have empathy, even if, your final conclusion, doesn't agree with them, or you still come down on the decision that what this person did is wrong, or this is not the best way forward. And I have reasons for this, but I do understand where they're coming from, and I can respect that other people don't see it that way, even if, they may be misled or, misguided. And if that's your final viewpoint, that's okay. But you don't want to, I think, coming too hard down on a controversy and having really absolutist views is not really something that's super promoted, even once you get into medicine and in the medical field. And that's sort of why it's not super favorable always in an interview environment. For that reason is that it's just not how, being a doctor is either.
So now we'll talk about some of the more specific topics to avoid for the specific station types. So first we'll talk about the why medicine stations. So as Alicia mentioned earlier, there's a lot of other professions that, that also help people, and other professions that require problem solving, etc. So you might be asked why medicine versus those other professions. So make sure when you give your answer that you frame it in a way that's about why medicine suits your needs, and that you're not trashing the professionals in the other fields. So, for example, saying, nurses don't do any problem solving or something like that. Make sure you're not talking like that, because that doesn't reflect very well on you. And it sort of raises questions about how well you're going to be able to work with these other professionals if you hold those kinds of opinions.
And I think a way to do this is I feel like often people don't have a good understanding of what the different, allied health professionals, what a lot of them do. And I think, you're going to have to learn it at some point, no matter what, no matter what field of medicine you end up in. And so just doing a bit of research into the statement that, oh, I don't want to do nursing because nurses don't do any problem solving. If you actually do some research into nursing and, what nurses do, well, it's just entirely untrue, the statement. And it comes off, as you said, as really, dismissive, and, it does, as you said, raise questions about, how are you going to work with people, how are you going to work with nurses if that's how you think of them? And I think that when you know more about these professions, it allows you to talk about why you don't want to do that you don't want to go down it into a career in some other allied health professional, career. You want to go into medicine because you actually know what the difference is and why, it suits you best. And I think that that's allows you as well then to discuss that in a way that's not trashy or, talking down on other options.
Yeah. Oh, and I also wrote as an aside, for the love of all things holy, please don't give money as your motivation for studying medicine.
And people will frame it in funny ways. I feel because I think it's pretty well established. People, people know not to say, oh, I want to study medicine because I want to, earn money. but I think that sometimes people can go about framing it in a way that they think it's okay to say it that way. Like, there's no
Yeah.
way that you should frame it to make it possible. And this is probably one of the cases where if that genuinely is your motivation, probably be blessed to just stay silent on that one.
And if that genuinely is your only motivation, you probably should find a different career because there are other careers that also pay
Yeah, it's
money.
probably not worth it. Yeah.
Yeah. Um, Now, other specific tips. So, when you're telling stories in the behavioural stations or whatever, if you are telling stories that involve patients, make sure to keep the information de-identified. And also, when you're telling stories, make sure that you portray everyone respectfully. Um, Even if the story is about, having to deal with a difficult character at work or something, like be try and be respectful, and also frame it in a way that you're showing, um, this person might have been difficult to work with, but I also understand that they were going through blah blah blah, so that like you're at least making them sound like they're a decent person who was going through a hard time.
Yeah.
Yeah,
I think remembering that medicine, any kind of medical career, it's all about teamwork. And so when they're assessing you, no matter what the station is, whether it's a wire medicine, whether it's a behavioral, whether it's a, whatever type of scenario they're giving you, when they're assessing you, if you come across as someone who does not seem like they would be fun to work with in a team because, you're too judgmental, too harsh, too critical, whatever it is, it's not, it's not what they're looking for because it's just any kind of health professional needs to be able to work in a team. So I think that kind of relates. There's probably quite a few things that we've said today that relate to that need to be able to work in a team and give respectful portrayals of everyone involved, respect other people's opinions,
yeah,
don't trash, other health professionals, that sort of thing. It all relates down to the fact that, you're going to be working in a team for a lot of your life and you're going to be working with a lot of other people. And that's part of what they're looking for is someone who can do that.
yeah. On the topic of respect, so the next tip that I have regarding the global health stations is that you have to be careful that you don't come off as patronising. As like, well, those countries are so poor or whatever. So one example of this would be medical volunteerism, which is a bit controversial. Actually, if you've done medical volunteering overseas without any relevant qualifications, so you went overseas and helped deliver babies, but you aren't actually a qualified nurse or midwife or whatever, be cautious about discussing it because some people may see it as being quite unethical. Because it's sort of like you're saying, well, this country is so poor that even this random person from a rich country can help. Whereas like that local clinic could have employed, like if the job is something that doesn't require a trained person to do, like that local clinic could have trained a local person to do it, and would have helped to stimulate the local economy and would have done a whole lot more good than random Western country person going over. So some people may see volunteerism as being unethical. I don't know if you have anything more to add on that one.
No, I think you kind of hit the nail on the head. Just be careful about, you know, understand that, we do live in a really wonderful and we're very lucky to, have grown up in, a certain environment, but also that, different places in the world will have different, cultures and customs and also just like different economies and opportunities and that sort of thing. And you don't want to come across as just sounding like entirely ungratefully privileged and just dismissing, the different challenges. And, health is different and different places will encounter different kinds of challenges. Like the kinds of challenges we encounter here may not be challenges that are encountered in a different country as well. So, just, yeah, I think patronizing is probably the right word that you use there. Just don't,
Yeah.
you don't want to come across judgmental
Yeah.
or superior. We
So
all want the best for our
yeah,
patients,
yeah.
no matter where you are.
So to sum up everything that we've talked about today, so even though many of the stations or questions that you come across will be based around a specific theme or themes, you'll still have a lot of room to put in your own experiences. So you need to think about which experiences of yours will be appropriate versus inappropriate to discuss during the interview. And as Alicia mentioned, if you practice saying or talking about some of your experiences, you'll be able to get a better feel of what works and what doesn't work. So,
Yeah, I think
so
that's, you know, practice, get used to talking about things, read and learn is probably the first step to practicing for your interview.
GradReady also has a selection of interview courses that you can sign up for if you think you'll need that little extra boost for your preparation. And you can find links to all of those on our website. So, best of luck for interviews, and thank you again for tuning in and listening to us today.